Okay, good afternoon, everybody. Lovely to see so many bright and enthusiastic faces here, which I hope is true, given that you've been sitting in this room for quite a long time. So my name is Cunnane. I'm the Director of Health and Wellbeing in the College of Physicians, and I work with the very able and wonderful Hadas Levy, who's in your midst. I'm also a Professor of Rheumatology in Trinity and at St. James's Hospital. So health, as you know, is defined by the World Health Organization as having many aspects to it: physical, mental, emotional, and social. And it's not just the absence of illness, it's actually fully participation in these various dimensions. But it's actually about more than that. It's about being energized, having a sense of purpose, feeling like you're part of a like-minded community, and as a trainee, being part of a positive learning environment. It's also about self-knowledge and self-care. This is my idea when I think of a doctor's res. Ample opportunity to meditate, having seen a few patients, maybe an on-tap massage, meanwhile while you're thinking about your next holiday, which is only a few weeks away. So I guess I can still dream about that, but the reality is that it's important that at least while we are at work, that we're reasonably happy and that we have a sense of physical, mental, and social well-being. And of course, to remember always our common purpose, which is to look after patients to the best of our ability within the resources available. But of course, there are many challenges to our health and well-being. At work, there are difficult rotas. There's the constant sense of fatigue, the lack of sleep, the lack of healthy food in many hospitals, the constant striving to get exams or to study interesting cases, to make presentations to the team or grand rounds. There's also the constant changing of teams, which of course produces its challenges. And there's no question that people are challenging. In your home life, there may be challenges too in terms of trying to make time for family and friends, maybe a family illness, trying to pursue your hobbies and keep up with those, which is very important, participating in sports and exercise, eating well, participating in self-care, and of course making sure that from a financial point of view, which is something we don't often talk about, that actually those things are also well taken care of in terms of pension, etc. So how are we doing in Ireland? Well, a study a few years ago by Blonit Hayes and others in the College of Physicians looked at the health and well-being of hospital doctors in Ireland. There were nearly 2,000 respondents, mostly female and mostly Irish nationals, but the results were interesting. So they showed that 7 out of 10 hospital doctors enjoyed being at work and had a positive sense of well-being at work. But only half of the people surveyed found that they had a normal sense of psychological well-being. 80% did not feel that they took adequate exercise, and 1 in 3 felt that they suffered from burnout, and 2/3, unfortunately, felt that they wouldn't be happy to talk about it. And 4 out of 5 described that they would turn up to work even when they were feeling ill. So the question is, what is burnout? It's a word that we hear a lot about, but it's talked about too much without actually defining exactly what it is. So it can be defined as a state of physical, emotional, and mental exhaustion caused by long-term involvement in emotionally demanding situations. So it's not a case of where you feel exhausted after a couple of nights on call. It's actually a more pervasive sense of lack of well-being. And it's particularly prevalent when passionate, committed people become disillusioned with the job from which they had previously derived their identity. So it's not somebody who's always been cynical coming to work and saying that they don't care. It's actually somebody who was previously highly committed, and it's nearly like a sense of betrayal to themselves when they feel that they can't do this anymore. It's not depression. It is distinct from depression, although the symptoms are similar, and there is a correlation between both. But burnout is work-related and is relieved when the work-related stress is eliminated in some way. Burnout can lead to depression, but depression per se does not cause burnout. And there are 3 particular dimensions to burnout. One is emotional exhaustion, which, as I've said, is pervasive, it's long-standing, it's not due to a couple of bad nights on call. Depersonalization means where you don't really care what happens to other people. You see a patient suffering and you think, there's this sense that previously having cared about it, you feel that you don't care anymore, something that would be very foreign to most doctors. And also with that is a sense of low personal achievement, that you feel what you're doing is not important, it's not very useful anymore. Again, something that would be foreign to most of us who work in the field of medicine. Burnout has been studied quite extensively in the US, and they have found that up to 50% of physicians, particularly frontline staff, meet the criteria for burnout. And of course, it doesn't just involve medical staff, it involves other staff members as well. Some things particularly contribute to burnout, so an excessive workload or a change in workload leading to excessive hours. Additional stress, so if a patient issues a complaint or there's a medical legal issue, you can imagine that that's a highly stressful event. In terms of being an NCHD, there can be dilemmas over career choice, there can be exam stress, job uncertainty. All of those can certainly lead to added stress. And I think of all of those things, that's certainly where the college can help. And from a personal point of view, financial worries, family worries, or lack of hobbies where the person identifies extensively with their job as opposed to with their life and all the dimensions of their life can also contribute to burnout. Self-care, you might think, is obvious, and I think many years ago I thought it was obvious, but I've learned a lot in those intervening years. So self-care in terms of your physical health is obvious. So looking after yourself, eating properly, taking adequate exercise, etc. We all know about it, even if we don't necessarily do it to the best of our extent. Looking after your emotions and having what they call emotional literacy. So if you feel bad at the end of a day, being able to articulate what bad means is actually a very helpful way in terms of recovering from that. And if you can articulate, then you might actually be able to decide what you might be able to do about it, and even to talk about it with somebody. Your spiritual self-care in terms of what your needs are, what you feel you would like to do with your life, what your vision for yourself is about. Social in terms of keeping up with your family and friends and relationships. Financial self-care, so making sure, for example, that your car is insured, that you have your medical counsel stuff up to date, that your bank accounts are not in overdraft, etc., more than they might be. From a professional point of view, again, making sure that you are doing all that you can to make progress during your BST is important. Environmental self-care refers to a number of things. It refers to making sure that you drive, for example, a roadworthy car. It might refer to the fact that you don't live in an unnecessarily cluttered environment, that your home and work life is reasonably sort of good, and that there's a sense of well-being at home and at work. So it's complicated to explain, but I think self-care is much more than you'd necessarily think. I also think it's important to look out for others because, of course, self-care doesn't mean selfishness. So look out for others, for your peers. If somebody's looking a bit down, particularly over a couple of days, it's a good idea to ask them if they're okay. And in Ireland, and I think maybe the Western world, we're inclined to say, how are you doing? And the answer is fine. But actually a better word, and I think the fine answer is because nobody really expects anything else. But a better word, if you really are concerned about somebody, is to say, so how are you doing? I noticed that you sort of looked a bit tired lately. Just some gentle introduction to really seek out how somebody's doing. But it's not just peers, it's also colleagues, and we're all part of a team. But also, I would think, don't be a bystander. So if you see something happening to others that isn't okay, it should be acted upon, not necessarily by yourself, but maybe to talk to other members of the team and see what can be done. So if, for example, you found that somebody was being bullied, it isn't okay to say, well, thank God that isn't me. It's better just to see what can be done and to show some leadership in that. There is a campaign that's called Civility Saves Lives. And that is an interesting thing because we're all used to people being rude. You might see people being rude on the Lewis, rude on the street, rude at work. We know it happens. But actually it has quite long-lasting consequences. So we know that the recipient of the rudeness certainly feels bad. And it has been found that 80% of recipients lose time worrying about the rudeness. So they actually lose time at work. It affects their work directly. It also affects the quality of their work and it reduces their time at work. If it's pervasive, it can actually cause the person to take time off work. But what about the other people? It actually also adversely affects the witnesses, so that they also decrease their performance. And it's also, of course, bad for patients. There have been interesting studies looking particularly at the emergency departments and also at ICU, and have found that teams that don't work well together actually have adverse patient care, adverse patient outcomes. So it is actually really important that we don't allow incivility, that we don't do it ourselves, and that we don't allow others to do it either. In that context, I think it's also important to understand boundaries. And boundaries are about respect for yourself and respect for others. They're about taking responsibility for your own actions, but they also require insight and perspective, the ability to be assertive and the ability to communicate clearly. So they're very nice in theory, but actually quite hard to do in reality. And when I was trying to think of an example of what I meant by this, maybe not a great example, but supposing you've got an SHO who's really hardworking, really keen to do a good job, really keen to impress, and there are other members of the team, but the consultant asks her to stay back on a frequent basis, maybe to admit patients, for example, and he might say, I really like your admissions, you're really good, and you're really going to go far, and thanks a million. And so she goes, that's great. But over a period of time, that isn't actually good from a point of view of boundaries. It's not appropriate of a consultant to actually ask somebody to do that and to pick out a member of the team like that. But also, she has boundaries too, and the longer she spends doing stuff that other people aren't being asked to do, that's out of work, out of the time that she should be at work, means that her boundaries are also being compromised. So how does she deal with that? So she could go and have it out with the consultant, but of course that isn't a good way to do it. That's not respecting his boundaries. So it actually is about being assertive, about communicating, and about actually coming to a resolution where the patient gets good care, but the SHO has a fair deal at what's going on, and also that the consultant understands that actually he or she needs to be fair to the whole team. Of course, it's important to know how and where to seek help, and there is always help available. So I never want to feel that anybody in this room ever feels alone or ever feels that they can't come to somebody for help. Of course, it depends what the problem is. So if, for example, it's a medical issue, that hopefully should be very straightforward. There's the team members, the consultant, etc. But if it's a personal issue, if it's a communication issue, if it's a team issue, if it's a bullying issue, then of course it becomes a bit more tricky. And if it's a health issue, or in particular if you feel that you have a mental health issue, that you feel down, etc., then there are plenty of places to turn to. In particular, the ICGP has a Doctors' Health and Practice programme, which can be looked at online. And there's also an online directory of GPs who are particularly interested in seeing healthcare professionals. And in this regard, I'd strongly recommend that each of you has a GP. You might feel, as I did when I was your age, well, sure, I'm healthy, why would I need a GP? But the nature of health, as you all know, is that it can be very unpredictable. And it's nice to know that if something unpredictable did happen, that you'd know exactly what to do, as opposed to having to, in the middle of a crisis, think, well, where am I going to seek help? So I would really strongly urge all of you to have a GP. There is also the Employee Assistance and Counselling Service, which is an independent counselling service paid for by the HSE for all HSE employees, but it is confidential and you can access it independently, so that for example, if you were working in St. James's and you decided to access this service, you can go directly and access it. Say you work in James's, and all James's will know is that somebody in James's access this, but they certainly wouldn't know the individual, so you can be assured of the confidentiality of this. And I think it is important to seek help if you do feel that you need it. Other supports include the Practitioner Health Matters for people with mental health or substance abuse issues. And we're now beginning to realise this whole thing called second victim, where if there is a patient who has a bad outcome, that the people looking after them can also be affected. And so this has been recognised by providing a medically induced trauma support service, and that can also be accessed online. Of course, the college have an array of ways in which we can help and would be very happy to help. There is an article or a document online looking after your health and well-being, which I'd strongly encourage you to read at your leisure. And there are also strategies and supports that can be accessed through the RCPI website. There are a number of current projects ongoing at the moment, along with the NCHD Committee on Wellbeing. And finally, the NHS have some very good resources online, and I picked out two that I particularly liked. One is, have you taken your breaks today? Because of course it's very easy to rush from one patient to another, from one clinic to a ward round, etc. But the truth is, if you're tired, if you're hungry, angry, late or tired, think halt and take a break, because it's healthier for you, safer for patients, and obviously better for everybody. The other thing I liked was this going home checklist. And I am a big believer in reflective practice, to think about how today went, to acknowledge one thing that was difficult during the working day and see if you can let it go, or indeed if you need to discuss it with somebody. Consider things that went well. Check on your colleagues and see how they're doing, see how you're doing, and then leave it behind and enjoy the rest of the evening or the weekend or whatever. So that's all I plan to say. But I just wanted to wish you well, to know that there's always support and never feel alone. That's really important.